Hey, it's late afternoon now, about 4 o'clock, and I got all my work done. So I'm looking forward to kind of hanging out outside for a little while. BJ's napping right now, so hopefully I'll have a good nap for a couple hours. And he's been on these antibiotics now for about 3 days, and I was hoping that they would clear up some of his confusion. Dementia patients often their confusion becomes worse if they have an infection, and BJ had an infection, and I guess I am seeing some change in his cognition, like he's recognizing words better and using words more precisely, but uh, I'm still seeing some weird things, and this could be because of the pain medication. Um, he's been like cleaning up the deck. He'll like hand me garbage, but there's nothing there. He'll put nothing in my hand, and I'll just kind of like act like I got something, but I don't know if he realizes it that he did something nutty, at the point where he gives it to me, or I don't know what he's. I know he's picking up that he's having some changes in his brain activity, but I don't know to what extent he's aware of everything. His brain's kind of misfiring. And the other thing is he keeps referencing, you know, his grandmother. He'll say, "Is grandmother and Aunt Betty here? When are they coming back? Is grandmother taking her nap?" I just the grandmother thing. I just change the subject matter whenever he brings it up, or I'll say she's up in Ohio or she's not here. So it's I haven't been able to give him that awareness that he's in the wrong time frame. So, and I guess a lot of it um, is the pain meds. This damp, cool weather we're having is just really hurting his joints and stuff. And he's been taking maximum pain medication, and then like today, he was still hurting, so he had to take his muscle relaxer and lay down. And I guess his that gives him some relief. I don't know if it's getting rid of the pain, but it's allowing him to avoid thinking about it. The happy news today is that he finally went to the bathroom. When you're a caregiver, uh, managing somebody else's bowels is unfortunately maybe part of your job. And when your patient's on pain medication causes constipation. It just always does. So he routinely takes, senna laxative, that's like a vegetable laxative, and a stool softener twice a day. And usually that's good enough as long as we keep him doing juices and eating some fruit. But he didn't go for 3 days this time because there was a change in the amount of pain medicine he used, so his body wasn't used to the greater amount, and he stopped pooping. So the happy news is today he did. If he wouldn't have done, we have to like start escalating then, because he'll start kind of panicking about doing it. So typically we go, first to a stronger laxative. I think there's one called, I don't know if I say this right, but Biscodale, and then you can get ones progressively stronger until like your doctor's got some special ones that he can prescribe. But normally, if the Biscodale doesn't work, we'll try the suppositories, and I kind of avoid that because that often he has accidents. So that, especially someone with dementia is not really aware of his body, especially when they're on pain medicine, and the suppositories will tend to all of a sudden explosively erupt from his body, and that's bad. And then the next, the next and I guess most extreme thing we need to do, and we've only had to do this once, thank God, is do enemas. And he was feeling so miserable at one point about a year ago, more than a year ago. We just had to do it, and it's one of those things where as a caregiver, you'll often find yourself having to talk the patient into doing something that the patient really doesn't want to do, and that you as a caregiver really don't want to do even more, a lot more. And giving an enema is one of those things. So I'm glad I don't have to do that. So the other case where you have to talk the patient into doing something they don't want to do, and you really don't want to do it, is like bathing. With BJ, it's just we don't have a place for him to, handicap shower or anything, so he needs to have sponge baths, and he never wants to do them, and I'm not really wild about doing them either, but I already told him, so essentially I'll warn him and say we have to do a bath this weekend, or sometimes over Thanksgiving we have to do the bath. Now you got to promise me we'll do it. A lady from the home nursing place came, and she was giving him baths like a couple times a week after he had a surgery. She kind of showed me how to do it, and I learned how to do it. But with patients, one of the things I noticed is like this is like another delicate subject. Pardon the pun, but when you give the bath, like he complained that the nurse hurt his wiener when she cleaned it. So, I go in there and I go, well, I really don't want to clean your wiener. Could you do that? Could you do that? Would you promise you would do that? And then the thing you need to do is give the patient, even if they seem like they're out of it or they don't really care, try to find something else to do in another part of the room and give them some privacy. That's the same with putting them on the commode too. It's just, you don't have to make a big deal out of it. Just kind of disappear for a minute or two and let them do their business. It's very important that, we have a clean wiener because, of these urinary infections. So this is uncomfortable, and I didn't know that I'd ever be talking about cleaning wieners on a video, but it's one of the things that you need to just get out of the way if you haven't worked with a patient. You need to just clear there and say, what are we going to do about cleaning your privates or whatever. So be sensitive, and the patient might not always realize that it's as uncomfortable for you as it is for them. So you're the one that is kind of the boss here. So just make sure it gets done, and if you need to peek, when you provide the privacy, if you need to peek to make sure it's getting done, that's fine. So, but it needs to be done. So that's we're going to do that this weekend. So I think that's all for now. This was a pretty intense one, but I wanted to get some of these gory details out of the way early on, so we can talk about more interesting things. So, well, it's the evening before Thanksgiving, and I think I'm going to drink coffee and relax and get psyched up for giving a bath in a couple of days. So, later.